Welcome back, viewers. If you're just joining us today, we are talking about plastic and cosmetic surgery. And on board with us is none other than Dr. Nelson Oduor. Dr. Nelson Oduor is a consultant plastic surgeon here at Aga Khan Hospital in Kisumu. Daktari, karibu tena.
Thank you very much for having me.
As we move on,
Yes.
please tell me some of the misconceptions about plastic and cosmetic surgery. Some of those common misconceptions about plastic and cosmetic, because when we took a break, we were talking about nose jobs, we're
Right.
talking about someone's belly being removed, we're talking about change of sex. If I was born this sex, I want to switch to this sex. What are some of the misconceptions? And even those which are, some of them just considered myths.
Yeah, so one of the biggest misconceptions about plastic surgery is that it's all about beauty and, altering form where, there's no need to do anything. So the common population, or at least in the past, when you mention plastic surgery, then it's what the films and the movies would portray a plastic surgeon does in terms of the cosmetic work. But until recently, or with the interaction with patients and the local population that we have, the understanding of plastic surgery being tied to the reconstructive work is becoming more exemplified, even outside the boundaries of the hospital. So you find that within the hospital, where there are different specialities, that's where the true core and the true meaning of plastic surgery is understood. But when it comes to the general population and the media and the society, until recently, the idea about plastic surgery was more of, just the beauty aspect of it. You're altering things that maybe because of time and because of the wear and tear of the body underwent some transformation. So you're trying to, reverse the hand of time to make them more appealing. But that's just one aspect of plastic surgery. Other misconceptions that I've heard, that I don't know that these usually borders in a joke or they're serious, is that, the word plastic, so some people believe that,
Plastics and
plastics inserted somewhere, or is involved with plastics.
What is actually inserted now that you're there? What
Right.
is inserted in the body? Talk about breast enlargement or breast reshaping.
Okay.
What do we have inserted in the breasts?
Right. So what is inserted is usually silicone implants.
Silicone implants.
And silicone is an ubiquitous material. It's there in the environment, everywhere. We interact with silicone on almost all perspectives. There's medical grade silicone and there's industrial grade silicone. So the silicone we're discussing at the moment is medical grade silicone. So silicone implants, you asked about breasts. There are very many different types and shapes of those implants. And they can be used alone, or they can be used with some tissues from the body to help bring the projection, for example, in terms of breast. A breast that is flat. So if you insert an implant in it, it introduces some volume. So you're able to get the right shape and projection that is needed. Of course, implants are foreign bodies. So there are techniques and regulations used to ensure that these foreign bodies, even the medical grade ones, are still safe for use in the human body, and the correct place where they are put on the human body. There are other types of implants. There are dermal fillers, so people who have maybe the face, there's some depressions, okay, or maybe some patients or some people don't have the correct volume that they want their lips, how they want their lips to look like. You can introduce some fillers
Into their lips.
underneath the dermis, which now gives the volume that is needed. There are also prosthetic implants that are used more or less like the orthopedic implants that are used. implants are, yes, the use is quite common, but they're very safe to use. In that there are studies which have been done both prospectively and retrospectively to look at the safety of these implants and how they interact with the human body. And what I can say is they're safe to use at the right hands.
I'll come to the risk factors and the safety part of it at some point. Now, what you're trying to say, to my understanding, there are different procedures for different genders. Like, for instance, there are procedures which can be done to women and procedures which can be done to men. Or the procedures are really done no matter what the gender is. For instance, Daktari, if today I want to switch sexes, I decide all of a sudden I want to be a woman, what is the first step? What would you advise me? I know you mentioned something earlier about going to see a psychologist or psychiatrist, psychological issues behind it, which will also come to it. But is it possible to change sexes?
It is very much possible to change sexes, but I would want you to understand that there are different hurdles towards some specific types of surgeries that can be performed, depending on the regions and the countries and the legislature that have been put in place. So in the West, mostly, sex change surgeries happen all the time, and usually after a thorough process of triaging a patient, which can take even up to 2 years of patient evaluation before such a huge surgery can be undertaken. All in all,
by patient evaluation, what do you mean?
by patient evaluation, what I mean is the consultation processes, the different number of sessions the doctor and the patient have, the different other specialities who are also invited to have a look at the patient to ensure that, you know, this kind of surgery is safe and the patient is not going to be in a bad state after such kind of difficult surgeries. So these different specialities would involve, for example, endocrinologists, so specialists who deal with hormonal problems, because you find that even before this kind of surgery you mentioned, the sex change surgery can be done, there are hormonal profiles, hormonal medicine that the patients may still need to take for a while to help them also achieve the sex or the gender morphology that they want. Men and women are different in terms of how their body looks like, and most of these changes have some hormonal perspectives to it. So the specific surgery which you mentioned, which is the sex change, it just doesn't involve this surgical aspect or the cutting aspect, but there are hormonal profiles involved, there are psychological profiles involved, there are maybe internal medicine profiles and consultations involved. But like I said, these are not usual surgeries that are done in the country here because of possible legislation that have not been enacted to allow those kind of procedures to be done.
Is it advisable?
Well, that's a bit subjective, subjective an opinion. What I've realized up to this stage of my medical practice is that patients are very specific with their demands, and it's upon me as a doctor to be able to help the patient meet their demands, or help them see alternatives to their demands. So whether sex change surgeries are advisable or not is a bit subjective, and my personal opinion may not ride the day.
Right.
Right.
What are the risk factors of these cosmetic procedures?
So
let's take, for instance, kind of undergone plastic surgery, cosmetic surgery, and have switched sexes. What are some of the risk factors that I face? And are they life-threatening risk factors?
Yeah. So various plastic surgery procedures have different risk factor profiles. So, for example, you mentioned the cosmetic ones, right? So there are some procedures which can be considered cosmetic, though in other light of prevailing circumstances, they may still be reconstructed. For example, a lipoabdominoplasty, commonly referred to as a tummy tuck. It's surgery that is life-changing because you find that after certain procedures like massive weight loss, after maybe a patient has lost 30 pounds, 40 pounds of weight, you find that the skin sags. There's too much tissue dropping because of gravity and the excess volume that was there, but now has disappeared because of the weight loss maneuvers. So you find that this kind of patients, they need skin tightening procedures, which in essence is not really cosmetic in that perspective. It's because you're trying to do body contouring. You're trying to contour the body, shape it in a way that the patient can be able to even have the right wardrobe to wear and even have that self-esteem. So yes, these procedures, because they involve massive surgical and physiological changes in the body, there's bound to be risks involved. And these risks, some of them could be life-threatening, some of them could be just risks which could be managed as the outpatient scenario and setting. So the major risks involved usually involve bleeding, infection, pain, risks involved because you're cutting tissue.
Which can easily lead to death.
They can, but we have ways of mitigating some of these risk factors that have been mentioned. There are major risk factors that because of blood clotting problems.
Yeah, chronic issues.
Those
Like you might be having hypertension. You might be having.
Or because of, for example, long hours in surgery in theater, patient is in a lying position, so blood sometimes tends to pool and clog and form a clot somewhere. It can travel to maybe the heart or the brain and all, cause some kind of problems. But usually these are some of the major risks that can be involved in these surgeries, but there are ways of mitigating these problems, preventing them from happening, and it's also part of the patient evaluation and the triage process, because most of the cosmetic or the aesthetic procedures are done within a cutoff of a certain BMI. BMI refers to body mass index. Yeah. So that one is you use the patient's weight and the height to come up with that. So there's some certain procedures which can be done above some BMIs. For example, BMI of 30 or 33 or 35. There are some patients who would require them to go through weight loss techniques before coming under the knife, just so as to reduce some of these risk factors that could lead to these problems. Because weight in itself, having massive weight, high BMI is a major risk factor for surgeries. Diabetes mellitus, hypertension,
HIV and AIDS.
Well, that is not so much of an absolute risk
So what
factor.
chronic diseases will you look at and advise a patient not to undergo the procedure because of such and such kind of diseases?
Like I said, there are no hard and fast rules to this. Each patient has specific needs, specific risk factors. I wouldn't say there are major or specific risk factors that if you have, then you don't qualify for surgery. But depending on the uniqueness of your case, we can have consultations and discussions and look at the pros and cons. If the cons outweigh the pros of doing the surgery based on the risk factors that you have, then it's always safe to abandon ship.
Good. Now, Daktari, is there a time that you can sit down with a patient and you advise the patient and tell them, I think this is enough surgery for you. You've had enough surgery. We can no longer do any more cosmetic or plastic surgery. Are there such kind of times, and are there factors that might lead to this, like age?
Yeah, it's a good question.
How many times do you think, basically, how many times can someone have plastic surgery?
So plastic surgery, that term is a very broad term. So
Is there limits to the knife?
there's no limit to the knife, but there are mitigating factors that may make us say, okay, it's enough
Among
knife.
the risk factors that you mentioned.
Very well, that's one of them. Then if at all the expectations that the patient has are not the same as what the surgeon can achieve, then it's always safe to not engage with such kind of patients, because you will not be able to achieve the results or achieve the outcomes that the patient envisions. So in such scenarios where what you're able to provide and what the patient expects do not come to an agreement, then it's always helpful to refer these patients to the various other colleagues to seek second opinions and to be able to come to a resolution whether something can be done or that's the end of it.
All right, now let's talk about social media influence. How do you think social media has influenced, especially young people, into going for this kind of procedures? And currently, what is the volume of young people coming for cosmetic surgery procedures because of social media influence?
Yeah.
And what kind of procedures are they looking for?
Social media has played a very huge role in terms of influencing plastic surgery practice, the cosmetic plastic surgery aspect that we're talking about, because more information is now relayed to people. People are quite aware of what can be done and what can't be done. And like I said, patients are very particular and specific with what they need altered or done for them. So as a surgeon, that might look trivial or seem trivial and not bothersome to you, but against the patient who has come to for your consultation, and it's only your guidance that will help this situation in terms of bringing a way forward. So many patients used to be comfortable with the status quo, as the age or whatever has happened, they're okay with the body. But once they know that something can be done to alter this and give a good outcome, help with the self-esteem, help with the wardrobe type of clothes, confidence, then they come for these procedures. Breast lift surgeries, mothers after breastfeeding or because of other reasons, they may feel like the breasts don't have good volume in them, breasts are sagging, may want the breasts lifted and the projection added. So it can either be a mastopexy, which simply means breast lift, or it could be an augmentation mastopexy, which means increasing the breast volume plus lifting the breast. So other procedures that patients may want would be including injection of Botox to help smoothen and reduce the effects of the aging face, for example. Those fillers that we mentioned, for example, there are other reasons that someone may have different contours of their body. Maybe fat that is there under the skin has been lost at a specific spot for a reason. So you may have dermal fillers or even fat graft injection to that to improve the contour. So social media has highlighted what plastic surgery is all about and the things that can be offered. And I think it plays a huge role in disseminating the information and helping.
Do you have celebrities coming on board for these procedures?
No, I've not had celebrities per se come to me for specific procedures, but I've had colleagues who've handled celebrities who've wanted a few things done on them to help them do better at their workplace and also in their social interactions. But for me, I've not had a conventional celebrity, but yes, we've worked with clients who
Secretary, just because of time, let us talk about psychological effects
Okay.
post-surgery, or maybe pre-surgery. What are some of the psychological effects that some of these patients encounter?
Okay.
For instance, I've come for plastic surgery, cosmetic surgery to be specific, and I wanted my nose done. And being African, I ended up looking like maybe an Asian or a European with my nose. I'm not looking like we've had cases of this kind of people some time back. For instance, someone like Michael Jackson who had a plastic surgery and the nose ended up looking something completely different. What is the psychological effect post-surgery?
Right.
And to just, because of time, to just tie it up with that, how long does it take post-surgery for these procedures to heal?
So the psychological aspect of plastic surgery encompasses what other patients will also go through in other surgeries besides the plastic surgery. And the biggest thing that I've noticed in my short practice is that anxiety and fear of the unknown is usually something that can have a psychological toll on the patient. But how do we go about this?
By saying fear of the unknown is what I will see on the mirror.
What I will
after surgery.
see in the mirror and how will I look, and so many questions that to a plastic surgeon who's probably been doing the same thing routinely many times will find that something not to really be a patient to be worried about. But then you see, like you said, each and every patient is unique and independent. So their fears and their anxiety and their questions are things we own individually. So in as much as it may be routine for the surgeon, but for the patient it's an experience of a lifetime. So usually, just like any other surgery, the psychological aspect is real in terms of anxiety and the fear of the known. But what's unique about my patients is that you find they have been through very difficult situations. It could be due to diseases, it could be due to trauma, accidents, and all that. So they more or less look at you as a gleam of hope, because you're going to provide for them something that was lost. It was there, but it was lost, and it's very meaningful to them. So I find more hope and encouragement from my patients who actually make you understand that you are really there to help them and give them the new phase of life that they considered probably had been lost due to the problems.
Talk to me about the recovery period. I know there are different procedures, but how long does it take?
Okay.
So
depending on how the wound is closed, so recovery period usually look at a week or two for a standard smooth sailing recovery period. So good patient, straightforward surgery, good post-operative outcome, a week or two, and we considered well healed. But then, because of so many mitigating factors, surgeries can sometimes not lead to the complete healing that is required. So the healing process becomes a bit prolonged. So therefore, the patient needs to have outpatient wound care management. So that's still part of the treatment, and usually within a month.
So in a month's time.
In a month's time, someone should be okay, very
should
stable.
be ready to go back to their daily life.
Exactly.
They can go back jogging. They can go
do their
to the
activities of daily living, albeit some because of different reasons could be graduated. So you start lightly, instead of going full force and full throttle on the activities you'd like to do.
We're almost coming to the end of the show, Dr. But I know you've talked about how you will set realistic expectations to people who are coming for this kind of procedures. But But to someone who's coming for a fast procedure, what would you advise them?
Okay, so it depends on the procedure to be done. Again, depends on whether it's reconstructive or cosmetic or aesthetic. If it's reconstructive, then usually the options are very much limited. It's either to proceed with the surgical option, which have been offered, or to negate the surgical option and continue the usual conservative management, which in most cases doesn't involve surgery. So if a patient comes to me and I feel like, they have a problem which could be solved by surgery, then I offer that option. But
you can also talk them out of the procedure as a first timer.
As a first timer, if it's reconstructive, and I feel like, the surgery is going to be very much beneficial, or there's actually a good reason, we can talk patients out of something if we have feelings that, and we know that maybe it's an overkill what they're doing, or maybe it's not necessary, all that. But all that depend on the discussions that you have and what it is that they expect to have.
Good. Now, Dr. do you think the demand for cosmetic surgery will continue to rise?
It will continue to rise. The demand will continue to rise because of patient awareness, because of the availability of resources to help solve these cosmetic problems, and more so because of the expertise and the material that surgeons have gained to solve these problems in a safe way.
Any latest innovations in plastic surgery?
There's so many innovations, including dressing materials, including equipment used to do surgeries. In the past, a procedure known as liposuction would involve, manually harvesting that fat from the body compartments, physically using, the hand, the force, and everything. But nowadays, there are machines which, you just connect and it sucks out the fat and all. So yes, there's so many innovations, including even these implants that we've been talking about. All those are innovations to help solve plastic surgery problems.
We're almost coming to an end of the show, Dr. But looking at me as I'm seated here, what do you think reconstructive procedure can undergo?
So it's one of the pitfalls.
Without let me take for instance, I don't have an idea of what kind of reconstructive surgery we want to, but I want my face to look different.
So it's one of the pitfalls that we are trained not to get into, where you're trying to figure out, or you're trying to determine what's wrong with the patient. I would rather the patient comes up and mentions the problem, then we work towards that. Because if I look at your face right now, of course there are a few facial features at seen that if you had brought it on the table and was more specific about it, then we'd have a discussion around that. And yes, I would talk you out of doing anything about them, but if at all you made your case and made it understood that you want it done and it will give you, I will go ahead with it.
All right.
Right.
Now, Dr. I want you to look at that camera, and please talk to the viewers. And I've taken a look at some of the scope of the work. Briefly, we can talk about it, and kindly anything that you feel we haven't touched on it, you feel this needs to be directed to my viewer this evening, kindly feel free to look at that camera and then talk to my viewer.
Right. Yeah. So thank you very much for joining this viewership. We've been discussing a lot about plastic surgery, and the specialty itself is quite large and quite huge. We usually say that if you feel like there's something wrong in your body and you want some answers, or you don't know what to do with that, then it's always a very good idea to have a consultation with a consultant, in this case a consultant plastic surgeon, who can help to make you understand those problems and the changes that you'd want to be made, and you come to an agreement after having a thorough consultation consultation, and you're able to make an informed consent. So in that perspective, there's a huge scope of work done by plastic surgeons in terms of both reconstructive and the cosmetic or the aesthetic aspect. In terms of reconstruction, plastic surgeons manage burn injuries. So from the acute phase, so that's when burn injuries happen, to the remodeling phase, or the scarring phase, when the burn injury has healed and there are scars, that's within the field of plastic surgery. Trauma, when there are road accidents, bad wounds, necrotizing fasciitis, degloving injuries, stimulaitis, we take care of those kind of conditions. And therefore, if at all there are patients who have long-standing wounds, chronic wounds, that don't seem to heal, or a burden that doesn't seem to have an answer to it, it's always a good idea to seek the consult of a plastic surgeon who can help you understand the problem and offer the solutions at hand. Birth defects, craniofacial problems, like for example, cleft lip and palate, is a very common problem that we face in our population. Patients who are born with split lips and holes in their palates. We do surgeries to correct those deformities at early age, so as to help the patients be able to function well in the society in terms of speech, feeding, and even how they look. So for example, there's some patients who can undergo accidents, domestic or even industrial accidents, where they get cut tendons and they're not able to use their hands. We also do those kind of repairs. So the scope of plastic surgery is very wide. When it comes to breast issues, enlarged breasts, especially gigantomastia, macromastias, we're able to do breast reductions and help to bring relief to the patient. So what I'd like our viewers to know is that there's plastic surgery services at here at Aga Khan Hospital in Kisumu, and usually hold consultation clinics every Thursdays from morning till afternoon, where we are able to see patients with different conditions and offer our advice as needed. I think that's what I can say.
Well, thank you so much, Dr. I don't think there is more to add. Remember, all this that Dr. is talking about is being done here in Aga Khan, Kisumu. We've come to the end of our program today. My doctor today has been Dr. Nelson Oduor, who's a consultant plastic surgeon here at Aga Khan, Kisumu. Until next week, catch me again on another segment of Ngima Makare. Have a good night and God bless you.